Good evening, everyone. We started the journey with the introduction of the master tongue. Then we discussed classification of the master tongue, like in the different body part. We are telling the numbering, like the points available in the finger called 11.01, 11.02. The point in the palm called 22 number point. In the same way, we have discussed these all classification, right? Suppose the points 99.01, 99.02, they are available in the ear. So this is the classification of the master tongue. We have discussed in the detail. Then also we have made these lines. We have made 8 lines, A, B, C, D, E, F, G, H. Okay, so we now already know how to draw the line. And if you have missed, then you can see the previous video. It's discussed in the detail that how to draw 8 lines around any finger. So from the thumb side, we are starting, that is A line. Then coming in the center line is C. Then the D going to the other side, that is E. In that way, we are drawing 8 lines. Even you can see in this image, starting from the A, B, C, D, E, F, G, H, total 8 lines. So with the help of this, we can discuss the points, we can draw the points very easily. Then we know what is the meaning of one chun. The meaning of one chun, the width of the one thumb, and we divide it in 10 parts. So single part is called one fan, means one chun is equal to 10 fan. In the master tongue, there is very important thing that is called reaction area. Like the point, there is one point that is called 11.07, working on the lungs, right? So we are telling if we insert the needle on the 11.07, the reaction area is lung. So it is working on the lung as well as the skin. This was the all previous discussion. So we are just going through. Then also we discussed about the 11.09, and it was just a general discussion. We will be discussing these all points in the detail one by one. And I told you, as per the master tongue, if you want to treat the knee, forget the knee, just treat the heart. There are many points available in the body. They're working on the heart, so they're working on the knee. Like the 11.09 is the very good point for heart. So the very good point for knee as well. And also we did needle insertion in the previous class. Then there is a number of list of the points. Someone is working on the heart, someone is working on the lungs, in that way, right? So there are a big list, but we are going one by one, so I'm skipping this list. Then we discuss the master tongue palm diagnosis. The point the area of the thumb is called earth element, so having connection with the spleen as well as with the stomach. Suppose we are looking here some red spots. It is a sign of stomach heat. In the same way, the index finger is connected with the metal element or the large intestine. Large intestine. So any discoloration, blue veins, red veins, black spots, it is doing the representation of the large intestine or the metal element. Then the middle finger till the pericardium is doing the representation of the heart, and we are going to put many points who is working on the heart, and we are going to put in the middle finger. It is whether we talk about the front side of the palm or the back side of the palm, these areas are same. The ring finger is having connection with the liver and spleen, mainly liver, right? So we will be putting many points in the future. We are discussing many points in the future. They're working on the liver in the same way small finger and the side of small finger doing the representation of the kidney. So whether I put point here or the here or the here or the here, these all points working on the kidney as well as the urinary bladder. So suppose someone is suffering with a back pain and we know back pain is connected with the kidney, we might treat here. For example, look at the point we discussed in the last class. These are the 2 points. On the side of a small finger, they are working on the kidney. So I told you, you can use these points for the back pain. Okay, this was the quick recap. We have spent entire 1 hour in the last time for these points. Let's move ahead. So now I'm moving ahead and want to discuss few more points. So definitely now I will be discussing many points available in the index finger. In the index finger, there are many points. They are very wonderful. But before that, I would like to start with a very interesting point and very well-known point that is called (11.06) and 11.24. Anyone who is learning Master 2, I'm sure knowing these 2 points, number 1, 11.06 and number 2, 11.24, because they are very well-known points. So let's start from there. 11.06. This point is available in the ring finger, right? And we know ring finger is the place where triple Barber meridian is traveling, that we are knowing. So the triple Barber meridian traveling from the ring finger. Okay. So ring finger is having connection definitely with the liver, but the ring finger is also having connection with the triple Barber. We can see here. If we look at the ring finger, we can see there's a location of triple Barber 1 or triple energizer 1. TE means triple energizer. Then we can see triple energizer 2, 3 and all. So this triple Barber meridian is starting from the ring finger, passing through the arm, then reaching to the eyes. This is the last point of the triple Barber. So we can see this is a long route of the triple Barber. Not only this, if you look at the internal circulation of the triple Barber, this is the internal circulation of the triple Barber. This is not only going in the upper body, triple Barber is connected with the upper body, means heart. Triple Barber connect with the middle body, means stomach and the abdominal area. Triple Barber connect with the lower body. That's why it's called upper Barber, middle Barber, lower Barber. Altogether, we are telling it triple Barber. Then triple Barber passing through the genital part, and we can see it's reaching till the knee, right? It's reaching till the knee. Actually, there is a 1 point on the back side of the knee that is called urinary bladder 39, which is the lower EC point of the triple Barber. So in the TCM also, when we put the urinary bladder 39, which is the point just backside of the knee, it's a wonderful point for the triple Barber. You can see in this image. If you look at the knee, the center point is bladder 40 that we know. And on the knee, we can see the eyes or the depression on the backside of the knee. So its center point is bladder 40, but if you go on the side, that is urinary bladder 39. As soon as you needle the urinary bladder 39, it means you are stimulating the triple Barber. You are stimulating the triple Barber means you are stimulating the upper GIO, middle GIO, lower GIO, and you are working in this entire route. So coming back to our ring finger. Suppose I am doing the treatment in the ring finger, I am stimulating this entire area, especially this, the name of this meridian is triple Barber, means who is keeping the body warm. When the body becoming cold, so coldness is the sign of impotency, infertility. When the body is cold, the person is not having good quality of sperm, and the person is not having good quality of fertility and sexual potency. So when the triple hormone is good, it is giving the good power to the heart. So heart can supply a good amount of blood to the genital part, penile part, even the vaginal part. And it's also supplying the middle part of the body. So our spleen and stomach is getting good energy, and even the genital part, right? So many times we see the body is cold, then we are going to use 11, the point who is available in the ring finger. If we talk about the male, if any male is suffering with any types of the genital problems, like the problem in the testes, problem in the prostate, or the impotency, infertility, we are going to use the point in the ring finger. In the same way, we talk about the female, if any female is having any types of the ovarian problem, or the uterus problem, or the uterine fibroid, we are going to use this point available in the ring finger. So let's go and see the points in the ring finger. So now look at the ring finger here. This is the ring finger. And the ring finger, the triple bottom meridian passing from the small finger side, right? And or we are telling it ulnar side. So on that side only, we will be drawing a 1 point. Suppose we divide this joint in 3 parts. This is the upper phalanges, this is the middle phalange, and the lower phalanges. So in the middle phalanges, if I draw the 1 point on the side, that is called 11.06. I would like to give you the exact location of this point. So let's see here now. Let's see in the other image. Now you can see in this image. Now if you are looking the ring finger, right? In the ring finger, we can see this is the bone, right? On the border of bone on the side, that is the location of 11.06. The other name of this point is return to nest, if you remember. I already told you earlier, the ring finger is the finger of liver, right? Ring finger is the finger of liver. So this point is working on the liver, and this point is working on the kidney as well. The question comes, why this point working on the kidney? So answer is this: what is triple varma? We are discussing the meridian. We are discussing the large intestine meridian. We are discussing the small intestine meridian. What is the triple varmer? The meaning of triple varmer, the meridian who is transferring the energy of kidney. So triple varmer means the pipeline, but inside the triple varmer, what is flowing? Inside the triple varmer, kidney energy is flowing. So now I would like to show you the exact location of this point, because this point is really very wonderful. That is called 11.06 or return to nest. 11.06. This point is very, very common for the male, right? When we are doing the treatment of the male, we always put this point any one side. We are putting this point any one side. Yeah. So coming to, because the location of this point is very, very important. So we should try to understand the location of this point. So I'm showing you fingers. Look at here. So this is the ring finger. We can see ring finger can be divided in 3 parts. Ring finger can be divided in 3 parts. This is the lower part. This is the middle part, and this is the upper part. And we can see this is the border of bone. This is the border of bone, right? So return to nest point is available on the border of bone. So we are putting the point just in the middle phalanges of the ring finger here. This is the 11.06. Remember the most important thing, it is working on the liver and kidney. This is the most important information, because this finger is the finger of liver, and triple varma meridian is the meridian of which carry the energy of kidney. So as soon as you are putting the 11.06, it is raising the yang energy in the male. So if the yang energy is, what is the meaning of yang energy? The meaning of yang energy, who is keeping you straight, upright, in the upright position, right? Yeah. Now, yeah, that is wonderful idea. We already have discussed the lines in the previous class, right? Lines. We started our journey from the line, right? So the line toward the thumb side, that is A line. Then we are coming, the center is C line. Then we are going to the side, that is E line on the side. Remember, A, B, C, C will be the center, then D and E. So E line will be in the yin yang border. This point is available on the yin yang border or in the E line here in the center. E line, not the D. E line on the side, right? And whenever I'm putting the point, we can choose the smaller needle. But right now I'm choosing the bigger needle so that you can see very clearly. This is a very good point, who improve the yang energy. So if suppose in the male, if the yang energy is good, then the erection will be good, because for the erection, yang energy is needed. The yin is heavy in the weight. So because of the yin, it will pull the energy down, erection will be very loose. Flaccidity will come. Not only this, if we are putting the 11.06 point, I will show you here. So look at here in the E line. In the E line, when I am putting this point here in the center, you can see how the point going horizontally. This is the exact way to put the point. Wonderful point. What is happening? When there is a coldness is happening in the body, then spleen never like coldness. That's why we are telling, if you are eating lots of ice cream after the food, if you are drinking the water from the refrigerator, if you are eating the raw salad, spleen will never be happy. So when there is too much coldness in the body, sometimes it's damaging the spleen, humidity is growing, and it's affecting the male prostate. So there is enlargement of the male prostate. So when we are inserting this needle, it's raising the yang energy in the body, heat energy in the body. And spleen is very happy with the heat. That's why if you drink the hot water, warm water, even the warm herbal tea, spleen will be very happy. Then spleen will be happy, spleen will be good, then it will not form unwanted phlegm, and phlegm is responsible for creating the prostate enlargement. Phlegm is responsible for creating any types of the nodule in the human body. Like there's too much phlegm in the prostate, it will create prostate nodule, prostate enlargement, right? So as soon as we are putting the 11.06, it's wonderful point, who is increasing the yang energy. Especially this is the very good point for liver and kidney. So kidney yang will be good. So there is a good yang in the genital part, and it will remove all the unwanted humidity, dampness, nodule formation. Generally, it's sometimes difficult to find out whether the male is having problem in the right side or the left side. But if some male is knowing that problem is right side, then put the point on the right side only. 11.06 point will be on the same side. Generally, in the master tongue, there is a one rules of the opposite side. 11.06 will be on the same side, but sometimes it's difficult to find out. Okay, prostate enlargement is there, but we don't know whether on the right side or the left side. Then one day you can put the point on the right side, another day you can put a point on the left side. Now, youngsters are suffering with the impotency. We can choose this 11.06 and we'll take one another point, 88.09, which I will demonstrate. 2 points. Number one, 88.09, and number two, this return to nest or the 11.06. We can improve the male impotency or erectile dysfunction in the male In the master tongue, this is the beauty. We always use lesser number of points, sometimes only 2 points, sometimes 4 points. 6 points are more than enough. And we don't use point bilateral. If we are using on the right side, we are not using on the left side. Otherwise, they will cancel the effect of each other. Lesser the point, fewer the point, more the effect. Suppose if we want to treat the male in erectile dysfunction, 2 points. 11.06, it will increase the yang energy. It will improve the liver condition. It will improve the kidney condition. And 1.88.09, I will demonstrate you shortly, today only. So right now my focus is 11.09. Whether this point is good for only male? No, male, female, anyone. Suppose someone is having swelling in the legs. Remember the formula: swelling in the upper part because of the lungs, like swelling under the eyes. It is because of the lungs. Swelling in the middle part is because of the spleen. And swelling in the lower part, it's because of the kidney. This is the simple formula. So we can divide the body in 3 parts, and in the different part, different things are responsible for creating the swelling. So now, why the swelling? What is the meaning of swelling? The meaning of swelling, when something is not circulating. So when something is not circulating, that is the swelling. What to do? Let's increase the yang. Let the energy circulate. Let's increase the yang, let the energy circulate, then everything will be okay. Let's see here. One minute. So 11.06 point is one of the great point. See, look at here, 11.06 is the point who is increasing yang energy, increasing yang, chi. What is the meaning of yang? The meaning of yang is movement. The meaning of yang means speed. The meaning of yang means enthusiasm. So your blood, your lymph will be running very fast. So swelling will go away. Especially we talk about the swelling in the leg, because I told you we can divide the body in 3 parts. Swelling in the upper part because of the lung, swelling in the middle part because of the spleen, swelling in the lower part because of the kidney. So swelling will go away. One more thing I would like to tell you. Many persons are suffering with the liver disorder, liver disease. And liver disease also creates swelling in the feet. And kidney disease also creating swelling in the lower part. So this 11.06 point working on both condition. That's why it's a very good point for this purpose. Many persons are having the deficiency of the kidney yang, and it's creating lower back pain and the knee pain. Then what they're doing? They're applying hot water, they're feeling good. They're doing hot fermentation, they're feeling good. So 11.06 is the very good point. It means we are doing hot fermentation with the help of point. Okay, 11.06. You're increasing the yang energy in the lower part. You're circulating the chi, blood, lymph in the lower part. Swelling will go away, knee pain will go away, and infertility will go away, humidity will go away, toxin will go away. You will be feeling lighter, energetic. Your leg will be having more power, because kidney is control of the lower part of the body. Lower part means below the genitals, both legs, bones of the leg, knee, ankle, each and every bone. So that's why 11.06 is not only good for male, it's also very good for the female. We are using this point for male and female both, especially for sexual problem, infertility, but for any other problem as well. Whenever we put the needle, we are doing the retention for 30 minutes minimum. 30 minutes is enough, right? Or you can do insertion for 40 minutes, maximum 1 hour is enough, right? But in the clinic, we are doing insertion for 30 minutes. So the question comes whether we can do the insertion for lesser than 30 minutes. I will tell you, in the master tongue, you put the needle and remove the needle, that is also enough. Putting the needle and removing the needle immediately, enough. Sometimes we put the point, remove it immediately, that's also working. So let's move ahead. Now I would like to go ahead, but before that, remember one thing, whenever I am putting any point in the ring finger, it's working on the liver and kidney. That's why during the marriage, why we wear the ring in the ring finger? Because ring finger is the finger of liver. Liver is having, in the female, liver is a great supplier of the blood to the uterus in the female. So we want to tonify the liver blood. Even the male, liver is a great supplier of the energy to the genital part. And kidney, we know kidney is deeply connected with the genitals. So when during the marriage, during the engagement, male and female are exchanging the ring and they putting the ring in the ring finger is a very scientific. Why they are not putting the ring in the index finger? Right? Why not? Maybe male and female, anyone is suffering with the diarrhea, then during the marriage they can put the finger in the index finger, because index finger is connected with the large intestine, right? Large intestine. So if any couple, if having diarrhea, both our couple is having diarrhea before marriage, they can exchange the ring and they can put the ring in the index finger, because index finger is the finger of large intestine. If male and female is anyone is having heart problem, then they can exchange the ring and put in the middle finger, because middle finger is the finger of heart. But when you are coming to the ring finger is very wonderful finger. It's increasing the yang energy. So the couple will be living a very wonderful sexual life because of tonification of the liver and kidney. Now, nowadays, there are lots of patients are coming, and especially we talk about the females, they are having too much problem in the ovary and the pain before the menstruation. There are too many problems. So let's see a few more things here. If you go see one by one, it's very clearly mentioned 11.06, a return to nest, which point just we discussed, is a very good point for the uterine problem, even the uterine tumor, any problem of the uterus, inflammation of the uterus, and abnormal menstruation. Any type of the discharge, like the white discharge, reddish discharge, and if there is a blockage in the fallopian tube, which is causing infertility, any problem which is having connection with the uterus, some female is having the history of miscarriages, you can put this point, and I think just to give the treatment for 2 months intermittently, like 12 sitting in this month and 12 sitting in the next month, you can check the condition of uterus, you can check the condition of fallopian tube, it will be in the very good condition. One of my patient came with a problem of ovarian cyst. I told my patient, please do the report after 15 sitting. Let me do the treatment and do the report after 15 sitting. I have given 11.06 and 2 more points. 2 more. I will tell you 2 more points. But patient was so impatient. He just checked the report only after 5 sitting, and cyst was not there just after the 5 sitting. It's working so fast. The master treatment is working so fast. And those who are doing the practice of the master tongue, all of my friends are telling me, previously they were chasing the patient, and when they started doing the treatment on the master tongue, now patients are chasing you. Just things have become opposite because of the greater results and the immediate results. So let's go ahead. So this 11.06, Now, whenever we are talking about the female, we are putting 11.06, but before the 11.06, we are putting one another point that is called 11.24. So for the female, the condition will be like this. First, you need to put 11.24, then you have to put 11.06, right? So what is 11.24? Now I will be discussing this, the wonderful point of the mastering acupuncture. The other name of this point is Fuke. Fuke, right? So, and the needle insertion, whether you do 11.06 or the 11.24, very, very little, near about 2 fan. We know 2 fan is very little, and even in the fingers, we don't have much space. We don't have much space, right? So let's see now. So we know F means Fuke, F means Fuke, and F means F line. F means F line. So the Fuke point is available in the F line of great thumb, or we can tell thumb. Okay, now the question comes, where is the F line? Where is the F line? Okay, so you should know where is the A line. If we talk about the thumb, see, if I'm telling about the index finger, A point is here, this side on the yin yang junction, then we are going like this, A, B, C, D, like this. A, B, C, D, E, F, G, H, like this. In the middle finger, A line is here, then we are going like this, A, B, C, D. In the ring finger, A point is here, then we are going A, B, C, D, like this. In the small finger, A point is here, then we are going A, B, C, D, like this. And when we talk about the thumb, same here, A point will be here. It will not be like the mirror image. If A point is here, the thumb also A point will be here, then A, B, C, D, E, F. Now you search where is the F line. Search where is the F line and draw one small line on the F, right? F line. So E, we know E on the yin yang junction. E in the yin yang junction. Now we are going in the F line. F line will be near the border of this bone. So circle the border of this bone and put the 2 points equally. So the points available in this lower phalanges, 2 points. So look at here again. If we know the line, everything becomes easy. So there's no any need of confusion. Only we can confuse. We will be confused if we don't know the lines. F line. I'm searching the border of bone. Now we are moving to the thumb because we are working on the another point, that is 11.24. Right now we are working only on the points on the finger. Why we are jumping for 11.06 to the 11.24? Only the reason because 11.24 and the 11.06 are couple point. They are working together. That's why we're jumping in that way, right? So now if you see, I am putting the point. First, I will put the point here. I am searching the border of bone and I'm putting this 1 point. That I will be putting another point. You can see from the distance these points are looking like this, right? Now if you see, these points are on the border of bone, the border and toward the index finger side, you can see on the border. So we have to put the point like this. If you remember, I told you a small finger is connected with the kidney, ring finger with the liver and is mainly liver and also spleen, middle finger with the heart, index finger with the lungs or the large intestine, and the thumb is having connection with the spleen. So whenever I'm putting the point in the thumb, the reaction area will be spleen, right? So the reaction area of 11.24 will be spleen, and these points are on the F line. There is no direction. Just we are putting the point because this is very convenient to put the point in that way. Like you can see, if you see from the distance, you will be, the point is looking like this. See, maybe like this, right? 11.24. Each and every person who is learning Master 2, and even he learned the Master 2 only for 1 hour, he will be knowing 11.24. It's so initial and the famous point, and the results are awesome. Suppose one female patient is coming to you, doctor, can you treat my ovarian cyst? Only 2 points. One side 11.24 and another side 11.06, only 2 points. Remember, we never put these points bilateral, otherwise there will be no any improvement. 11.24 points will be only one side, and 11.06 will be on the other hand. I'm putting the 11.24 in this hand, 11.06 will be in this hand. Then it will be a perfect energy circuit. So 11.24 here, and let's, for your understanding purpose, I will tell you 11.06 in the other hand. We never put both the point in the same hand, and we never put both the point bilateral, right? It is the rule. Otherwise, there will no any effect. More point will cancel the effect of each other. So now I will give you few more things about these points because these points are really wonderful. In the Master Tongue, very lesser sittings, even the 12 sittings are giving wonderful results. Sometimes only 5 sittings. So now 11.24 or gynecological point, useful for all the female uterine problem, whatever the problem is this, infertility, menstrual problem, pain during the menstruation, pain before the menstruation, more bleeding, less bleeding, ovarian cyst, whatever the problem, 11.24 point will be helpful. We can see in the thumb, these 2 points you can see on the side, on the border of bone. We can see the location of these 2 points. If we talk about the, we can see once again, 11.24 or called Fuke on the thumb, 11.06 on the ring finger, right? Suppose some female is suffering with the infertility. We are putting the 11.24 point. Suppose we are putting this point in the right side. In the right hand, I am putting 11.24 point. And in the left hand, I am putting 11.06 point. Just I have to add 2 more points. One is 11.09. It is the excellent point for kidney. I will show you the location. And one another point is 11.04. Only the 4 points and the protocol is complete, done, over. Enough. So we can see this is the location of DU20. From the DU25, I'm going 1.5 to anterior. That is the location of 10.04 point. It is a very good point who is working for uterus. Okay, the discussion of this point in the detail will be done when we'll talking about this point. Right now, I will tell you the point at the level of DU20 or the top of the head. These points are really very good for the uterus. So what we are doing from the DU20, we are going 1.5 to an anterior, and we are using 1 point that is called 10.04. It is a wonderful point. just the 4-point combination. So look at here. So from the hairline, this is the hairline. How to search the hairline? You can choose the distance of forehead is 3 chun. Now from here, if I'm going 5 chun, then I will be reaching on the DU20. Now from the DU20, I am coming 1.5 chun. That is the location of 10.04. This is a very good point for uterus, for female genital part. We will putting the one needle here. It's a very simple to put a needle in any direction. Maybe if it is visible. Right now it's visible. See, just single point obliquely. When we are putting the needle in the scalp, needle is we are putting slanting, oblique. Visible? Good, wonderful. So this was the second point. So 11.24, 11.06, then 10.04. I will give you a little idea about this point. The DU20 to DU21, this area is very good area who is working in all the genital problems. Suppose there is a prolapse of the uterus, prolapse of rectum, any problem around the genital part, this area working, especially 10.04, the point 1.5 to anterior. In the male, female both, it's working for the genital. Let's see the last point because I want to complete this protocol. I don't want to leave in between because I first have to discuss 11 points, all the point in the finger, but let the protocol complete. 4 points for infertility, for improving the quality of the ovum in the female, for increasing the libido or the sexual desire, for balancing the female hormones, for balancing everything in the female, for regulating the hormones of the female, for removing the menstrual pain in the female, any problem which is connected with the female reproductive part, genital part of the menstruation, 4 point. 11.24, 11.06, 10.04, and the last point will be 88.09. I will tell you here. This point is also called look at my leg. So if you look at my leg, you can see this is the knee. You can see this is the knee joint, right? So we know this is the inner side and this is the outer side. Inner side we have yin meridian and outer side we have yang meridian. We are talking about the inner side. Let's come to the knee. So this is the medial side of the knee. This is the lateral side of the knee. This is the patella bone of the knee. And this is the medial side of the knee. And we know the spleen meridian passing from the medial border of the patella, right? So if this is the medial border of the patella, if I'm going 2 chun, and that is the location of spleen, that is the location of spleen 10. If from the medial corner of the knee, okay, even one more thing I would like to tell you, you can see there is a muscle here. This is the muscle. If you tighten the knee, you will see the muscle here. This is called vastus medialis muscle. This muscle. In this muscle, their location of spleen 10 point here. So spleen meridian is going like this. So let's start from the knee. The just on the border of knee, this is the 88.09. Right. Even this point is also important. We will be discussing in the future. Many times we are putting 2 points, but right now our focus is this. Just on the medial border of the patella, on the root of spleen meridian, this is the point that is called 11.09. This is very good point for kidney. Look at here, if it is visible, see. Look if it's visible. This is the 11.09, right? Just be the medial border of patella. That's it. Medial border of patella. It's not the spleen 9. Spleen 9 is here. See, spleen 9 will be here. We are going from the medial side. Spleen 9 will be here. Right. Then we are going from the knee. So spleen 9 will be here. On the upper border of this bone, then we are following the border of bone, border of TBA bone, spleen 9 will be here. Then spleen meridian is going like this. Then spleen 10 will be Tuchun proximal. Spleen 9, then the spleen 10. But this point just on the upper border of the patella bone, but in the root of the spleen meridian. That is called spleen, that 88.09. Suppose if we put 1 point here, 1 point and the spleen 10, these 2 points become very wonderful combination that we are going to discuss later on. But right now, what I want to tell you, 4-point combination, 4-point protocol completed. 10.04 spleen 9, sorry, 88.09. Fuke and return to nest. Try this protocol and treat the condition of females. In the master tongue, do not combine too many points. Don't try to put too many points. Suppose you are thinking, okay, let's put 3-4 TCM point, 3-4 auricular point, 3-4 this point, that one. You can use the point, there's no problem, but don't use too many points in the master tongue, because master tongue treatment is very much effective. But if you are choosing more point, effectiveness will reduce. Oh, let's see now. So now, you know all the 4 points now. 11.24, 11.06, then 1 point is here, 10, 10.04, and the last point here, from the knee on the medial border of the patella, that is 88.09, or very good point. The other name of this point is penetrating kidney point. And penetrating kidney point is the excellent point. Done, over. Let's move ahead. Okay, so let's I would like to discuss, I would like to work on the leucorrhea. Leucorrhea is the very common problem, but the wonderful thing is this, just by 4 point you can treat the leucorrhea or the white discharge, only the 4 point. One will be 11.24, another is 11.06. When you are using this point, 70% protocol already completed, 11.24 and the 11.06. And the female suffering with the leucorrhea, only 2 more points you need to use. It is written here, 22.04 in the 5. Okay, let's see here. If you look at this is the palm, and these are the bones. First bone, second bone, third bone, 4 bone, and the 5 bone. These bones called metacarpal bone. Metacarpal bone, each and every metacarpal bone is like a complete body. So they are doing the representation of whole body, each and every metacarpal bone. So we can treat the whole body just by any long or the tubular bone. So suppose we are taking the example of the second bone. We can do the imagination of whole body, right? So we can do the imagination of head region, of chest region, and the genital part, right? In the master tongue, there is a 2 formula. Number 1 is called normal imagination, and number 2 called reverse imagination. The meaning of reverse imagination, suppose I am doing the imagination of head here, it will work. And suppose I am doing the imagination of head here, in the reverse manner, it is also going to work, right? So let's come to the point directly. In both conditions, in the both different condition. Suppose I am doing the imagination of head will be here, then genital part will be this side. And if I am doing the imagination of head here, genital part will be this side. So we are putting two more point. This is called 22.04 and this is called 22.05, or the other name of these points are lingu dawai. Lingu dawai. Lingu dawai, one of the great acupuncture point in the master tongue. So with the 11.24 and the 11.06, just you need to use lingu dawai. This protocol will be working for the white discharge and the leucorrhea. And the most important thing is this: if the female is having lower back pain, you know how much time it will take? What do you think? How many days it will take to cure the lower back pain if you put these 4 points? How many days? Only 5 minutes or less than. Needle in, pain out. Immediately, you can try. You can try. Immediately, instantly. Just remember one thing, how I try this point. Suppose one female is telling, can you treat my white discharge? Okay, I'm asking, do you have lower back pain? Yes, yes. Okay, tell me your lower back pain in the right side or the left side? The right side. Okay, okay. Right side, then I will put the lingu dawai on the opposite side. Lingu dawai, opposite side. Even the Fuke is the main point, 11.24. Will be opposite side. Okay, so the female is suffering with the lower back pain in the right side, but main problem is white discharge. So right side pain, I will be putting the 11.24 and lingu dawai here, and 11.06 will be on the same side. That's why I'm telling you 11.06 will be always on the same side. I've already having many videos of the previous classes where I've demonstrated lingu dawai, but I will demonstrate once again. So I can feel the bone here. I can feel the bone here. So I can feel the upper border of the bone and we'll be putting the one needle here. In the master tongue acupuncture, see, the one needle is here, upper side. And one needle I will be putting, I am following the border of the bone and going as maximum as possible, searching the last union of this metacarpal and this metacarpal bone. Second point will be here. Lingu dawai. Okay, lingu dawai. Excellent point combination. And you will be surprised. Needle in, pain out. So another point will be putting on the border bone. Before putting the point, I will pump this muscle and put the point. And I know there are many acupuncturists, they are doing this. See. Just on the border of bone, the last union of the bone. You can see. So 11.24, lingu dawai and 11.06 will be the same side. Finish, done, over. Leucorrhea, white discharge, red discharge, lower back pain. This is called protocol management of the master tongue. 4 point, unbeatable result. Unbeatable. Patient will be feeling good in lower back pain. And I know many of you are doing master tongue acupuncture, they are having experience. They know immediately pain will go away, immediately. But we never claim in the clinic because sometimes God also take our examination. Okay, sometimes for maybe 2 patients, you will create the immediate results, but for 1 patient, you might take more time. Okay, so never claim it, just do it, right? You will be surprised. There are many cases, in many cases, you are going to achieve the wonderful results. Because suppose one female is having Because I tried this point for many female, even one female was not responding with the treatment. I tried all the 4 points. Then I thought, what wrong I'm doing. That after few days, find out she was suffering with the uterine cancer, right? And she was not knowing that time that she's having uterine cancer, right? So in that way, sometimes we are putting the point, but we are not achieving the result. The reason might be what we are thinking problem is little deeper than that, right? So we have to work more. But our work will not going to waste. Our work will be worthful, useful. It will do something or the other. So now I will giving you one example. Many female suffering with the PCOS, polycystic ovarian syndrome. And because of PCOS, they are having delay menstruation, right? Delay menstruation. Only 4 points. Only 4 points. We will be achieving wonderful results and menstruation will start on that time. What are those 4 points? 2 points are fixed, what we have discussed right now. 11.24 and 11.06. So let's see here. So 2 points are fixed already. If some female is having delay menstruation is not coming on the time, there might be many reasons. Maybe blood is not enough or blood is deficient. Female is having poor blood condition. Or maybe she is suffering with the PCOS or polycystic ovary, which is also responsible for delaying of the period. So we have to use 11.24, 11.06. Sometimes you will be thinking, okay, which side to use 11.24, which side to use 11.06. If you are not able to find out, okay, which side to use, ask the female, do you have some problem? Okay, you have back pain, you have knee pain. If the female is complaining, yes, I am having this pain, use the 11.2 for opposite side. Or if we are not able to find out any symptom, then start from any side. So today you can use 11.24 on the right side. Tomorrow you can use the left side. In that way you can keep on changing. And 11.06 always will be complementary in the other side. So with that, if the female is having delay menstruation, we have to use 2 more points. One is REN 24. Another is 10.20. Excellent 2 point. Excellent. REN 24. REN 24, one of the great point here. See, this is the REN 24 or the CV24. Why this point? Because REN 24 is connected with the central line. It's having connection with the genital part. Because CB, we know CB1. CB1 is the point of the genital part. CB1. Okay. So there's a formula that is called the formula of first and last point. If there is a problem in the first point, you can use the last point, and CB24 will be the last point, right? It's a wonderful point. So we are using it. CB24 is, even you can do the acupressure here. If the female is having some problem with the menstruation, you can do the acupressure here, right? So that's why if the male is having some genital problem, we are pulling the hair like this. If they are having here, otherwise we are telling them to do the acupressure here. And the female is having some problem, we are pressing this point that is called CV24. It will help to bring the menstruation on the time, CV20. So one point will be here, remember this area is the area of genital, because face can be divided in 3 parts, upper, middle, and lower. The upper part of the face doing the representation of the upper body, middle part of the face doing representation of the middle body, lower part is doing the representation of the lower body. Now This area is very deeply connected with the genitals. That's why one point we are going to use, even sometime we are using one needle, two needle, and three needle like that. Okay, but just a single point also enough. So one point will be here on the center. So look at here. Look at here. This is the CB24. These points are not painful, right? Now the fourth point. So 11.24, 11.06, CB24, we are working for the delay menstruation, delay period. Period is not coming on the time. The last point is the wonderful point will be here. Okay, where? So from the corner of mouth, if I'm going half tune down, then again I am going half tune in. From the corner of mouth, I'm going half tune down, then half tune obliquely in. That is the location of the point that is called 11.20. One of the great point. I have used this point for many patients. 11.20. This point, like from the corner of lip, we are going half tune. And another point obliquely inner, I will be showing this point in the image. Now I'm telling you, suppose any patient is having any type of the kidney disharmony. Kidney means this problem is also connected with the kidney disharmony. We can use this point because kidney means lower part of the body, and I told you we can divide the whole body in three parts. So look at here. If you look at in this image, from the corner of mouth, if I'm going half tune down, then half tune medial, there are 2 points. This is called 1010.19 and this is called 1010.20. Both points are very wonderful. Sometimes we can needle both the point together. So one point is for half tune down, one point is obliquely down. This is the half tune or 0.4 tune, and this is also the half tune. 2 points. These both the points are very wonderful for lung as well as the kidney. Remember, lung as well as the kidney. If you remember this, then you will achieve a great results. Why to remember that these 2 points are working on the lungs and kidney? I will tell you the reason. Suppose someone is having breathing disorder. What is breathing disorder? Breathing means you inhale and exhale. As per the acupuncture, we inhale in. Then air is going in. Kidney is holding the air. Then we are exhaling out. So lung is exhaling out. Kidney is inhaling in. Lung is exhaling out. Right? Inhale, kidney. Exhale, lung. Suppose kidney is weak, then I will not able to inhale. Little bit only. Done, over. I will not able to breathe deeply if kidney is weak. In the same way, if lung is weak, I will not able to exhale full CO2 out. Right? So breathing is connected with lung and kidney, right? That's why we do pranayama, inhale deeply, hold the breath for a while. You are holding the breath means improving the power of kidney because holding is the power of kidney. Then you're exhaling out, that is the power of lung. By the pranayama, we can increase lung and kidney both. Just practice inhale and exhale, right? When you are swimming, many persons are swimming. We used to play in the childhood. Okay. We are closing the nose, going in the water, then we're trying to hold the breath as much as possible. We are coming out. Okay. It's a wonderful pranayama. So when the person is coming to you, doctor, can you treat my asthma? We have to treat lung and kidney both. Sometime one, sometime both. So now see, this is the wonderful point. Who is working on both? Whether the lungs or the kidney, both. That's why. One person is having weakness of the lung. If you remember advanced TCM, in the advanced TCM, I told you if the person is having weakness of the lung, might suffer with the shoulder pain. So remember, this is the excellent point for the shoulder pain. Immediate shoulder pain is going away. As soon as you put the point, shoulder pain is going away. So let's see. From the corner of the mouth, I am going half tune down, then half tune in. So this is the point. Wonderful point. Then from the corner of mouth, I'm going half tune down. This is the point. Even I can take long needle, cover both the point with one needle. I have tried this point. One patient told me, I'm having asthma and back pain. Asthma means lung and kidney. Back pain means kidney. Put this point, immediately pain will go. On the, if right side pain, left side pain will go. Right side pain, put the point on the left side. Then one patient told me, doctor, I'm having shoulder pain and the lower back pain and asthma. Then I told, okay, let's try this point because he's having asthma. So let's try this also. So as soon as I put the needle, right back pain and the left shoulder pain gone with the single needle. The same point working for the shoulder pain as well as the back pain. Opposite side back pain, but the same side shoulder pain. Then I started using this point at many patients having just shoulder pain. Shoulder pain right side needling. Left side, same side needling. But for the back pain, opposite side, as per the master, these are the very good point for lung and kidney, and especially for the female suffering with the delay menstruation. Right? So female is having delay menstruation, you put this point. If the female is suffering with the shoulder pain, trapezius pain, neck pain, or the back pain, with the same point, the pain also will go away. Right? So only 4 point, 11.24. Then 11.06, REN 24, and this point, never put point bilateral. Bilateral effectiveness will become, so the question comes whether in the master tune we never put any point bilateral. No, some point we put bilateral. We will be discussing later on. Some point we are putting. But most of the point we don't put bilateral. So the 4-point combination, it's written in the PDF. It will be given, it will be attached with the course website. So this was the 11.24. There lots of things are remaining discussing. Okay, still we have to discuss lots of things about the female gynecology, because female gynecology is a very big topic. And we are going to discuss all the protocol one by one. We have to discuss all the point in the finger. So maybe discussing tomorrow. Okay. So because this is starting, and so we are moving a little slowly. So remaining part will be doing tomorrow. If you have any question, you can ask in the group. We will reply you, right? Thank you so much. Let's close the session. See you tomorrow. Tomorrow we have class on the same time. Have a nice day. Closing the session.